Thank you, Mr. Chairman, and good morning, Administrator Johnson. Welcome back to the Health Subcommittee, and thank you for your superb leadership at the helm of the Health Resources and Services Administration, overseeing more than 90 programs that improve the health and well-being of all Americans. You head up the agency with grant making, and it's the dispersal of those funds in HHS that really make the policies dance. So thank you. Today, our subcommittee is considering 8 bills to extend critical public health programs, bolster the health workforce, and address the broken organ transplant system. We're going to hear testimony about 5 health programs that expire on September 30th, community health centers that are really core operations in our congressional districts, the National Health Service Corps, the Teaching Health Center Graduate Medical Education Program, the Special Diabetes Program, and the Special Diabetes Program for Indians. First, we're considering a bipartisan bill to extend mandatory funding for community health centers and the National Health Service Corps for 5 years. The Community Health Center Fund provides support to nearly 14,000 health center locations across our country. These health centers provide primary care to 1 in every 11 Americans. We cannot do without them, including 1 in 5 Californians, regardless of their ability to pay. A community health center in my district, the Asian Americans for Community Involvement, provides a full spectrum of care through a multilingual team of doctors, nurses, and patient navigators. They've earned a superb reputation for the care that they give to people in the community. And at this health center, the team can speak more than 40 languages to ensure their services are responsive to cultural beliefs, to practices, and preferred languages. The National Health Service Corps is a highly effective program that's been connecting providers to patients in need for over 5 decades. I'm disappointed that funding for these programs is not adjusted for inflation, despite the clear need, but I support the bipartisan reauthorization. We're also considering programs to improve access to primary care. We have to stay on this because that's the entrance to the entire healthcare system in our country, including the Teaching Health Center GME program and the Special Diabetes programs. They support viable primary care workforce for low-income communities by providing residency, and we spoke about this on the phone, residency training at federally qualified health centers. The Affordable Care Act enabled the teaching health centers. Can we not talk in the background here? It's distracting, please. The Affordable Care Act enabled teaching health centers to train residents. 13 years later, these centers have proven they can successfully train residents who will build their practices in rural and underserved urban communities. This is, a giant bravo on this because it really is working. But funding for this program remains elusive and inconsistent, preventing it from reaching its potential. I support the legislation we're considering today to permanently authorize the THCGME program and fund new training sites to increase resident physician spots, and I believe that this subcommittee can get to a bipartisan agreement on this reauthorization. The other expiring programs include Special Diabetes and the Special Diabetes Program for Indians, which provide critical investments in research and care for those living with diabetes. I have more to say, and I'll say it as we move through our hearing today because my time is almost up. But I want to thank you for your leadership, and I want to thank you also for sending out to each one of us HRSA in our congressional districts, because this really brings it home about what HRSA is doing, the grant making, and the difference that it's making in the lives of our constituents. So with that, Mr. Chairman, thank you for holding the hearing, and I yield back.
Thank you.
And welcome to the chairwoman's daughters. Are they still here? Right here.
Oh,
Yes, yes.
she outed you.
Yes. Yeah. Future women members of the Congress.
Absolutely.
Yeah.
We do welcome you here today, and I thank the gentlelady for yielding